talk to your kid. Don't sit down at the dining room table and say, now we're going to have a talk.
Youth that do gamble are 6 times more likely to develop an addiction as an adult.
You have this certain mentality, never my kid.
They shouldn't feel isolated for making a healthy choice.
For a safe, healthy, and drug-free community.
Watch Step Up to Save Our Children today.
Hello, and welcome to this podcast of Step Up to Save Our Children. My name is Denise Mayer, and I am the founder and the director of Step Up Anderson Township, which is a coalition for a safe, healthy, and drug-free community. Our mission is to educate parents and caregivers to have meaningful conversations with their own children on the topics of underage drinking, vaping, marijuana, fentanyl poisoning, and mental health issues. In this podcast today, we sit down with Mothers Against Drunk Driving.
Alex is the Regional Executive Director overseeing MAD, Michigan, Ohio, Indiana, and Kentucky, and a former national president of Mothers Against Drunk Driving. Alex came to MAD after suffering a near-fatal crash caused by an intoxicated boater in 2010, when she was only 13 years old. Since then, she has dedicated her life to fighting for a day when no other child is forced to face such a tragedy. Welcome, Alex. We're so excited to have you today.
Thank you so much for having me.
Absolutely. Well, I go way back with being a supporter of Mothers Against Drunk Driving, I think probably into the 80s. Would that be right? That when I first heard about it and started to support it, with some donations here and there. And I know it's morphed and evolved into so much more than it was even back then. So tell us a little bit about, what your role has been and what the organization has done, to change and with the times. And it's really just going to be you. You tell us everything you can.
So much has changed over the last 45 years. MAD's 45th anniversary will be this September. In 1980, Mothers Against Drunk Driving was founded by a group of mothers who had been faced with a tragedy that none of us want to ever encounter, but they had. We were founded by a woman named Candace Leitner. She had lost her daughter, Carrie, to an impaired driver. And it started with that. It started as a grassroots effort of a bunch of moms understood that something was happening that shouldn't, and something was hurting people that shouldn't. And so they wanted to bring an end to it. Since MAD's founding in 1980, drunk driving deaths have been reduced by more than half, but we've done so much more than that. In 2015, we added to help fight drugs driving to our organization's mission because impairment is impairment. While we know that alcohol is still the leading killer on our nation's roads, we know that drug impairment is on the rise. Polysubstance use is on the rise. There are new drugs all the time that are killing and injuring people on our nation's roads and waterways. So it's incredibly important that we help address that issue, but also support those who have been impacted. I came to MAD nearly 15 years ago. I was 13 years old when my crash happened, and my family was supported by Mothers Against Drunk Driving in terms of the criminal justice process and things like that. I began volunteering with MAD pretty soon after the crash because I knew then that I wanted to be the last little girl this would ever happen to. I know nearly 15 years later that I wasn't. But I also know that because of the efforts of Mothers Against Drunk Driving, because of the efforts of law enforcement in our entire communities, more little girls have made it home safely in the last 15 years. I got involved pretty early on and was in high school, finished high school, went to college, and all that good stuff. Upon graduating from college, I worked for a boating and water safety nonprofit known as the National Association of State Boating Law Administrators. In my work there, I did Coast Guard and federally funded research on drawing a parallel between boating under the influence and driving under the influence. Driving under the influence is something that would have been acceptable in the 70s, early 80s. It was something that people did.
Absolutely.
I even heard someone describe it as a rite of passage the other day. But now you would never watch someone consume a beer, be inebriated, get in their vehicle and drive off without saying something or at least feeling some type of way about it. Unfortunately, we have not seen that cultural shift when it comes to boating under the influence in other recreational vehicles. And so I wanted to understand why it is still so socially acceptable for people to consume alcohol and then get behind the wheel of a boat, ATV, etc., or worse, to consume alcohol while they are behind the wheel. And so I did 2 years of this research for the U.S. Coast Guard, really focusing on the fact that this is happening and that the cultural shift hasn't occurred everywhere. At that time, I was invited to come back to Mothers Against Drunk Driving in a larger capacity and to put my name in the hat for the national president role. Prior to my service, national presidents had been primarily women that lost their children. I did not believe that I was going to be the best fit for the next national president because my story was so very different. But my story did bring to light that this happens to people it shouldn't happen to. At that time, there had been 14 prior national presidents, and primarily they had been women who lost their children or another loved one. They had not had someone who was injured and had not faced another loss due to drunk or drug driving, nor had they had someone who was 24. And so I was not sure how that was going to look for Mothers Against Drunk Driving, but not only was it an opportunity for the organization to take a bit of a different step, it was an opportunity for me to demonstrate that this happens to people that it should never happen to. I speak all over the country to people of all ages and to all different kinds of communities. And I hear a lot, especially from young people, "Oh, I'm so sorry that happened to you, but that would never happen to me." The fact of the matter
Isn't
is,
that amazing? It's
absolutely.
amazing.
The fact of the matter is, it happens, and it happens to people it shouldn't happen to. If there was anyone in the world that this should have happened to, which there's not, I can promise you that a 13-year-old in her dad's backyard wasn't it. But it did happen. And that's why I'm here. And so that's one thing that is incredibly important for us to continue to emphasize is that this does not discriminate. Drunk and drug driving don't care where you live, what you look like, how much money you make, or where you come from. It is something that happens to people that it shouldn't.
Exactly. And I think when you attend like a rally for MAD, you see how many from different walks of life that the people have been so impacted by this. And that to me, is just amazing. I lost my niece to drunk driving, and I'll get into that later. But that was just such an eye opener. And I think one of the other things, because you were talking about recreational vehicles, boating, I think initially we thought only driving automobiles, and that type of thing. But when you think about all the alcohol, particularly, and other things probably that are consumed during the boating, and like you said, a lot of people think, oh, that's a rite of passage, and barreling down the river or the lake at, unbelievable speeds, and you're intoxicated, and you've got this, for the most part, a huge piece of machinery, and what that can do, like you said, to you as a 13-year-old, that just makes me sick to my stomach thinking about what you must have gone through.
There is not a reasonable expectation of safety on the water. So that's one thing that is important that we emphasize. A person who is in a car, if they are a passenger and have a non-drinking driver, if a passenger has consumed alcohol or another impairing substance, they have a reasonable expectation of safety. There's a seatbelt, they're strapped in, they're enclosed, all those things. On the water, it's not that way. 2 out of 3 deaths occur when a boat is mooring or at anchor when alcohol is involved,
Really?
which goes to show us that, yes, it's incredibly dangerous to operate a boat under the influence, but it's also incredibly dangerous to be under the influence on the water. There is not a reasonable expectation of safety. People who consume alcohol fall overboard, swim in areas that they shouldn't, and people die because of this.
Absolutely. And then, I think we forget about some of the other recreational vehicles that when operated by someone under the influence, and we'll get into the marijuana and that a little bit too, but like ATVs, and things, all-terrain vehicles and things like that, so many people are killed on those. And, some of it is just recklessness in the operation of the vehicle. But, when you add a substance, especially with young people, and maybe they're pulling some sort of, even like a tractor, and they're pulling some like a wagon with other kids in it, and they're acting crazy and whipping around or whatever. I had a nephew, a great nephew, who lost his best friend in that kind of an accident. So we know that these things happen, but for the most part, we don't talk about them.
Absolutely, because it's seen as something that's acceptable. And, so much of our experience is based on our community and the things we've been through. I live in central Kentucky. And while I live in a city, a lot of Kentucky is very rural. And so it is not out of the question to hear of drunk lawnmower operation incidents. There are parts of this country where impaired snowmobile operation is a real problem. And so these are things that I think people just don't pay enough attention to realize.
Well, I think that Matt has done such an amazing job over all these years with the designated driver concept. My kids are in their in their 40s, I guess, right now. And they would never think about driving a car home from, an event or whatever, inebriated. I mean, that wouldn't even cross their mind. I mean, they can lose their jobs, they can lose, of course, their life, or, run over someone else, all that. But that's just too big of a chance to take. And so that, to me, is the biggest thing, one of the biggest things that Mothers Against Drunk Driving has impressed on that generation. And I think even on this next generation, that it's way too important to not have a designated driver, someone that can take over and be sober and get you home safely. But unfortunately, I think we still live in an era now where, with the recreational marijuana has come in, and people are doing both, or even just doing the gummies or whatever, and they are impaired equally or almost equally. Depends on what the alcohol limit is, in the blood. But and I think we're in for a real rough ride with this. What are your thoughts on that?
Polysubstance use is something that is particularly concerning. We know that alcohol is still far and above the leading killer on our nation's roads, but polysubstance use is on the rise. And when people think about, oh, I'm going to consume a little bit of this and a little bit of this, they don't imagine that when you put those substances together, the impairing effects are exponential. And so it's important that people understand that not only consuming the substances in and of themselves, but how they may interact together is of great concern. And to your point, designated driver is something that is so incredibly important. And a point of emphasis is that Mothers Against Drunk Driving is not a prohibitionist organization. We are not against adults of legal drinking age consuming alcohol. We just ask that if your plans include alcohol, you plan ahead for how you're going to get home safely. The designated driver is not the person who's drank the least. The designated driver is the person who hasn't drank at all. And so it's important that people understand we want people to have fun in whatever way they choose to do that. I don't by any means believe that alcohol is how you have to have fun. I do not drink, personal decision, but we want people to have fun and enjoy their lives however they feel to do that in a legal and safe way. But make sure they make decisions that make sure we all can get to go home at night and we all get to go home in one piece.
Right. And that we don't have to bury our children and go through, the agony and the tragedy that accompanies that. We had a young man come out and talk to the students out here at the high school. He was not drinking, but he got in a car with a drunk driver, and they were, believe it or not, running around in a cemetery and ended up hitting a big monument. And this young man is paralyzed now from the neck down. And, he can't walk. I mean, he's in a wheelchair. His life has been totally impacted. So it's not just the ones we bury. It's the ones that live, with these continuing chronic illnesses. And, we look at our soldiers coming back from war, and it's not unlike some of the survivors of some of these drunk driving incidents. And
Absolutely.
then the mental part.
And that is a perspective that I think is so important that we continue to talk about. Matt has always done an incredible job representing fatalities and representing loss. But admittedly, the organization has not done a good job of talking about traumatic injury over the years. And I think much of that leads to some of the survivors' guilt that maybe some of us feel like we have to be okay because we didn't die. We have to say that everything's okay. And my perspective here really shifted years ago. About 10 years ago, I was 18. I was speaking at a Mothers Against Drunk Driving national conference, and a woman who had lost her daughter came up to speak to me. And she said, "I'm so sorry for what happened to you." And I said, "No, ma'am, I'm sorry. I am the lucky one because I lived. You lost your daughter." And she said, "I never want to hear you say that again." And I said, "I'm sorry." And she said, "My daughter passed away, but she's in a better place now. You're the one that has to wake up every single day and live with what this man did to you. And there's nothing lucky about that." And
I
that
get that.
was
Yeah.
the perspective shift that I think I needed at the time. Of It's not that I ever felt lucky to suffer with a brain injury or wake up in the morning and put a leg on. I just felt like I had to feel like I was because I lived. But I do wake up every single morning and put a leg on.
And I mean, just think of that. I know another young girl that was in a boating accident, lost her leg as well when the boat backed over her because they were, somebody was inebriated and wasn't really paying attention, and they threw the boat in reverse instead of forward, and she was skiing on the back and took her leg off too. And those are things that, you will live with. Obviously, you've been living with them. And I think you shared too with me on our phone call that you broke almost every bone in your body when that happened. I mean, those have to be long-term chronic problems that you're going to have going forward.
Absolutely. I'm often asked, what was recovery like? And my answer to that question is, I'll let you know when it's over. Once a trauma patient, always a trauma patient. Some of us don't
Right.
recover. Legs don't grow
No.
back. Brain injuries don't go away.
They
And one
don't.
thing that I think is incredibly important to emphasize, and as I've shared, I have a daughter, and we kept our daughter in a bassinet next to me until she physically didn't fit in the bassinet anymore. The reason for that being her moving into her room took away my ability to comfort her at night because I have to wake up and put a leg on. The man who ran me over didn't just do this to a 13-year-old child. He did this to someone that became someone's mom. He did this to someone that wanted to be a professional and wear heels without a limp and do all of those things. The 13-year-old that I was that day is not the woman that I became.
No, not even close. And really, in most ways, you gave up your childhood, to this trauma. And that's so unfair. And, just for somebody to have that second or third drink and operate a boat, it's just so unfair. And I don't know. I feel so bad for everybody that is impacted with this. But I think if we can impress on our young teen drivers, my grandson's just turned 16. He just got his license. And, I don't see this happening, but you never know. I mean, you absolutely know. And you can't say, well, it never happened to my child or my grandson or anything like that. But the impact that it has on the driver themselves, I think people discount that. So like you said, you have the survivor guilt, but when you've taken a life or you have taken or impacted somebody the way that you've been impacted, I'm not really sure how the person that did that can ever really live with themselves, can feel okay about that in any way. So I think that affects their mental health going forward. What do you think about that one?
I think for some. I don't think for
Okay.
all. The reason I say that, I've
And how
met many
bad is
people.
that?
Yes, I've met many people over the years that have been involved in a crash such as this, and they feel that remorse and they acknowledge that the decision that they made was a decision and they take responsibility for that, but also they're heartbroken and devastated by what they have caused. Not all.
Right.
I will say
But
that
not
the
all.
man who ran me over will never be sorry for what he did. He has convinced people in his life that I'm dead, so they'll never try to find me. He will never apologize for what he has done.
Right.
And so there, unfortunately, are some people who do not believe that the decision they made is as damaging as it is. But to speak to that, these are things that impact entire communities. I was the only person
They
injured
do.
in my crash. But you can't say that the crash didn't impact and influence the life of my mom and brother who watched the crash, my dad who heard the crash, my husband who I didn't meet till 8 years later, and my daughter who I didn't have till 13 years later. It will affect each one of them every moment of their life because wife, mom, etc. wakes up and puts a leg on and deals with all of
Absolutely.
this every day.
Absolutely. Absolutely it will. Well, when my niece was killed, and she was killed by a drunk driver, impaired driver. So both. She was alcohol and marijuana. Had been sitting at a bar for an entire afternoon, consuming both, and it was 4th of July, and so for some reason, I guess she thought that was acceptable. I have no idea. And so she had a little girl too that was about maybe, I don't know, maybe 6 or so. And so she was a mother, and she got in her car, and it was a big car. I think, trying to think. One was a Lincoln Navigator and one was a Suburban. And she ran into my niece head on. And they weren't even able to ever resuscitate my niece. They airlifted her, tried to airlift her on a really rainy night to Columbus, and that didn't work out. They couldn't do it. So she was by ambulance, and she coded several times and then passed away at the actual hospital. So this woman was taken to jail at some point. We all went up for the sentencing hearing and everything, and she got 8 years. So for 8 years, hopefully she's thinking about that and the impact that it had on our family, on our whole family. But she's out now, and who knows? I have no idea, and how that affected her child. So I think if you walk down a busy street and talk to people, I don't know what the statistic is, but it has to be really high of how many people have been impacted by a drunk driver taking someone that they love. Yep.
Average 2 out of 3 people will be impacted by drunk or drug driving in their lifetime. Whether they are impacted because they know and love the victim, they are the victim, or because they know and love the offender.
Right. Yeah. It's just incredible. But, I hope that we can impress on parents and caregivers that have children that are driving, to really sit down and have a talk about the things that can happen when you're not paying attention, when you're, consuming something. Usually high school is where there's more of a problem sometimes than college, only because for the college kids are on foot, a little bit more than, but those things can still happen with different kind of vehicles. So yeah, I know so many stories, and they're all tragic, and they just make you shake your head and think how important it is for this word to get out there from Mothers Against Drunk Driving and Impaired Driving, that people understand how important it is. When I'm driving down the highway and I see a car crossing over the double yellow at me, and a lot of times they'll swerve back over, and I think, wow, are you on your phone? Are you under the influence? What is going on here? And you really don't know. Until they hit you, you don't know what they're doing. So I think the distracting thing with the cell phones and all that just has added to all of this. So now, if somebody that's inebriated and now they're trying to make their phone work, oh my goodness. So I don't know. So do you go around and travel to like schools, or, what is your audience most of the time?
So our audience is anyone and everyone that will listen. In my role as national president, I traveled the country and spoke to students and community groups and hospitals and law enforcement. There was no one that we didn't talk to. In my role now, I don't travel quite as much, which is nice. But we do have a team throughout Michigan, Ohio, Indiana, and Kentucky that speak to young people, speak to law enforcement, speak to offenders through our Victim Impact Panel program, or members of the community. So primarily now, my role is spreading awareness for our issue and speaking to members of the community. But we do have underage drinking and other drug use prevention programs that are targeted at teens and parents, encouraging them to have these intentional ongoing conversations about substance use with the teenagers in their lives. But we also have a program which is called our Victim Impact Panel, where we have victim volunteers as well as staff speak to individuals who have been convicted of a DUI in hopes that they will understand that these decisions have consequences and not repeat the same mistake.
Yeah, I think sometimes our young people and even older people don't really understand the ramifications of what the law will be for them and how that could impact the rest of their lives. Like you said, like going to jail, being their licenses taken away maybe permanently. There are a lot of other impacts that aren't necessarily life threatening but they do impact obviously their decisions and their jobs and going forward. And does MAD do much policy work?
Absolutely. One thing for young people in particular that we always want to emphasize is we want young people to make the decisions now that are representative of the person that they want to be. To your point, not only are these consequences injuring or killing yourself or someone else. Yes, that happens and it happens far too often. But when young people consume alcohol or other drugs, whether or not driving is a factor, there are so many repercussions and so many consequences, whether those are legal, financial, educational, professional. There are so many consequences for people underage who consume alcohol and other drugs, even more so those who make the decision to get behind the wheel. MAD is very involved in policy making and policy decisions, both state and federally.
Well, I know that my niece's death resulted in Annie's Law in Ohio, which is an interlock kind of thing for the ignition if you're under the influence or whatever. So, I mean, all of these things probably aren't effective by themselves, but together, maybe, I know that was a big jump because it's just like you said, Mothers Against Drunk Driving are not prohibitionists. They're not trying to keep people from ever, imbibing or having alcohol, but the repeat offenders, particularly the people that, have been convicted of DUIs and continue to do that. We really have to get these people off of our streets and out of our neighborhoods and out of anywhere where they can injure and hurt our community. And sometimes that's a hard thing to do.
We know that the average drunk driver has driven drunk more than 80 times before they are arrested the first time, which is of particular concern when we talk about the fact that a first-time DUI offender is very rarely, if ever, the first time someone has made a decision to get behind the wheel impaired. It's just the first time that they got caught. And because of that, it is all of our responsibility to be part of the solution. Someone doesn't have to be a member of law enforcement, a legislator, or a victim with a personal story to be a part of the solution. They just have to be committed to making the right choice and ensuring that those around them do too.
Right. And I know at one point we had driver's licenses in Ohio that you knew that person had been convicted of a DUI, maybe even repeated DUIs, and then somehow got their license back. And, you knew what I guess those have gone by the wayside. I don't really know, but they were kind of an orange color license. I haven't seen those in a long time. So I'm kind of thinking that probably was somewhat ineffective. I mean, everybody tries different things to figure this out, but it's difficult. That's for sure. So anyway, well, we sure appreciate you being on today. And I'm trying to think if there is something else I wanted to ask you about. We talked about a lot of this stuff. I wonder, though, what MAD's position is going to be on, like you said, poly substances, where there's more than one type of thing. And I'm guessing it's all probably the same. So I don't know if there's a different approach. I don't think people have any understanding as to how high people get on this high potency marijuana. And then you add the gummies in there, maybe add some alcohol too. And we have no way of even knowing that. So like if there's a drunk driver, you do the breathalyzer and all that. But really with marijuana, there's no quick test that I'm aware of that they can even know how bad it is.
Yes. So some states are pursuing oral fluid testing, which has been a tool in the toolbox, and that's been helpful. But we know far and above more research is needed. We are out as an organization and as a victim myself to end impaired driving, and that includes polysubstance impaired driving. But we don't know all the answers. There's a Journal of American Medicine study out right now that says there's no level of THC at which a person can unequivocally say they are unimpaired. So how do we set a per se limit? How do we advocate for this is the limit at which someone would not be impaired below this level? It doesn't work like alcohol. And there are so many different strains and so many different types and ways that you consume now that I just don't think there's enough research to be able to say this is safe and this is not. And so until that happens, impairment is impairment, and we have to treat it all the same.
Right. And it's like you said, marijuana can be smoked and, but the dabs and the oils and the gummies and all of the things that can be consumed and can be consumed together, you can be above 100% THC. And so people wonder why these kids have gotten so psychotic or jumping off buildings and doing kind of crazy stuff. Well, there's a reason for it, and there's no testing. So when you said about the saliva, tell me a little bit about how they do that.
So some states are doing a program that involves oral fluid. As you said, we don't have a roadside test that is standardized for marijuana or other drugs in the way that a breathalyzer, an SFST, those types of tests are. And so it is a challenge in that some states, which is of particular concern, if they test for alcohol, they breathalyze someone on the side of the road and they are above 0.08, they stop looking. So we don't necessarily know how big of a problem poly use is when we don't have all the answers in terms of how many of these alcohol impaired DUI drivers did have drugs in their system as well. But some states are piloting oral fluid testing programs, and that is not a typical roadside test. It still would involve taking things to a lab and those pieces, but they are piloting oral fluid to determine drugs that are in a person's system among certain classes. Of course, they don't test for everything, but that could give us some answers in the way that breath-based systems do currently for alcohol.
When, besides the breathalyzer, before they had the breathalyzer, they'd make you walk down the street and, you have to go through certain maneuvers. And I'm wondering at that point, if say the breathalyzer is negative or very low or whatever, but the person still appears to be very impaired. They can't walk down the street. They can't, put one foot after the other. I'm not totally familiar with what they do, but it changes. But wouldn't that be sort of a telltale to think, we better take this person in and do a little bit more testing? I'm just wondering what law enforcement does about that.
Yes. So that's why the 0.08 blood alcohol concentration limit is a per se limit. Yes, that's something that they use as a tool to determine if people are under the influence, but impairment is impairment. And that's why it is used in conjunction with the standardized field sobriety test, which is the one leg stand, walk and turn, horizontal gaze nystagmus, those type of things. That is important as another tool for officers to determine whether or not a person is safe to operate a vehicle. We have so many cases that have happened, and while they are, of course, much more rare than impaired driving, it does happen that people have some type of medical episode. They are not under the influence of any substance, but they are a danger to themselves and others on the roadway. And it is important
Sure.
that officers remove that person from the roadway too. And so the SFST is a tool, but one concern there is with all these new drugs, they don't all show up the same way in a person. And so it's hard to know. The SFST, the standardized field sobriety test, was established to look for alcohol impairment. So it may not capture other types of impairment that wouldn't show up on a breathalyzer either. And so that's a particular concern, is what are we looking for? Polysubstance use affects people differently depending on which substances they've consumed. Drugs in general can affect people differently. So it's not as easy as if they show this clue, it means they're impaired by this drug. We just don't know.
Right. Right. And like you said, it can be even like some elderly person that's driving down the road, erratically. And, they think that and really it's just that they shouldn't be behind the wheel, period. But, yeah, I don't know. I just think that, we're entering summer. I know it's not quite here yet, but we are entering summer, and the boating and, outdoor activities, ATVs, all these kinds of things. And driving in general, just being out and about, and the kids, feeling, summer's here and we're going to be behind the wheel, and, it's all going to be fun. And it is, hopefully it is fun, but, we just have to impress on them the impactfulness of one of these tragedies, and how it can not only affect the person that's been hit or killed or maimed, but it also can impact them. And I think that that's mentally. And like you said, of course, there's going to be some that are diehard alcoholics probably that are never going to, agree that they have done some horrible damage. But kids are pretty impressionable. And I really think that knowing that they have now really basically flushed their whole life down a toilet because of a choice that they have made, and now they have to live with. It's overpowering, I think. And I just hope that we can get to them and really explain that, so that they take the staying away from being behind the wheel very seriously if they have been in some way impacted.
I hope so too. And we know that between Memorial Day and Labor Day is often categorized as the 100 deadliest days on our roadways. This is a time of year where we know a lot of people are killed in distracted driving crashes, but especially in impaired driving crashes. It is a time of year when these numbers skyrocket, but it's also a time of year when people should be enjoying their lives, not worrying about what they're going to encounter on the roadway. And to your
Right.
point, these numbers, and when we talk about the 100 deadliest days, does not even include boating under the influence, riding an ATV under the influence, those things, which also inevitably go up in the summer.
Absolutely. Absolutely. Yeah, I always say when we have a really great spring day and the high school kids can get out and get in their cars and just, they're inevitably an accident. I can't even tell you, because I'm old, how many times that has happened, because they're just all fired up with the sunshine and the warm weather, and they get in their cars and somebody makes a bad choice. And, that might even just be just because they're young, not necessarily even impaired. So, yeah, I don't know. Well, I certainly applaud Mothers Against Drunk Driving and the work that you have done and the work that you continue to do. I just think it's an organization that is just so important. And it was kind of came back to me when we had started going to support things, different chapters, I guess, around, the state and whatever, have different things supporting the families of the victims of drunk driving. And we went to those with our whole family, and you have a team, and, everybody gets money for the team and all that. But I think just being a part of that kind of brought it all home to me that this is so important. And it's so important for the victims and their families that they have that support from other people that have been through this. So.
One of the most important things about MAD to me as a victim is there are not many places in the world in which you don't have to explain yourself. Explain why you have one leg. Explain your feelings on alcohol. Explain why you don't go hang out with people on holidays, Labor Day, July 4th, New Year's Eve, why you don't even go to dinner on those nights because you don't want to be out driving. There are so few instances in which you don't have to explain yourself. And when people find themselves with MAD, at a walk like MAD, at some kind of event, it is truly the one place where you don't have to explain because everyone gets it.
Right. Exactly. Yeah, that's very true. Very, very true. Well, I can't thank you enough for being on today and taking the time to talk to our audience. We are really trying very hard to reach parents, caregivers, people that care about kids, where they are. And that's so hard. I'm sure you've been to many, many presentations. You'll have great speakers, and then you have a handful of parents that actually come. And that has been our experience over the years. And it's devastating, to be truthful. You feel embarrassed. You plan things, you market it, and then people can't come or don't come. And so this is our attempt to do these podcasts and bring this information on all of these topics right where parents and caregivers can do it sort of on demand. They can get on there, listen, throw a load of wash in, go feed the baby, whatever, and come back and listen to the rest of it and get some good information. So these podcasts are on YouTube and Spotify. And again, Alex, thank you so much for being on today. And congratulations on your new baby and your life. And I'm so glad for you that you are moving not past it, but forward. So
thank you so much. Thank you so much for having me. Thank you for sharing your niece's story and for letting us get to know Annie through you. But thank you also for bringing light to this issue. It is so incredibly important, and we can't talk about it enough.
We can't. That's for sure. Okay, Alex, thank you so much. You have a great day. And to our podcast, to our podcast audience, thank you for being on today. If you are interested in these podcasts, please go on YouTube, subscribe to our channel, which is Step Up to Save Our Children, and you will be apprised of each podcast as they come up. You can choose to listen or not listen, but you will, you'll know that they are on there and what they're about. And anytime that you want to go to our website, which is www.stepupanderson.org, the podcasts are on there as well. So thank you again for being on today. And please pass along the message for Mothers Against Drunk Driving. Talk to your children, talk to anybody that'll listen, and make sure that we are all on the same page. Thank you.